Speaker Thissen, are you ready to present? I see you in the audience, and I would like to honor your time. Members, we're going to move to House File 341. And Representative Lee, after Speaker Thissen introduces himself, would you be so kind as to move the file? Welcome to our committee, Representative Thissen.
Thank you.
It's nice to have you in education policy. Please say your name for the record.
Yes, State Representative Paul Thissen.
And welcome again. Representative Lee moves House File 341 to be laid over for possible inclusion in an omnibus bill. Representative Thissen, please present your file.
Thank you, Madam Chair. And I did have, yes, a witness to, if he could just join me, if that's
Excellent.
all right with the chair.
That would be just very good.
Thank you. And I'll just briefly go over it, and then the witness actually is from St. Thomas Law School, and they kind of worked on bringing this idea forward. So that's why he's joining me today. So this bill is, well, on its face, fairly straightforward. It requires cultural competency training and policies to be adopted related to two areas. One, with referrals to special education, and secondly, with also some early interventions that we've put in place to avoid getting kids referred to special education. And I want to first start by saying this, this is not a silver bullet, or it's kind of a mediocre solution at best. But it's the start, I think, of a conversation that we need to have. And I do think it could have an impact in starting that conversation. That's what I really want to do. I just have a couple of facts I want to go over. And this is focused, more on Minneapolis, because that's my school district, but I think this is true in lots of places across the state. We have this disparity between among ethnic groups about who's referred to special ed. 21% of African Americans were referred in the last 2 years. 25%, 1 in 4 American Indian students were referred to special ed in the last couple of years, as opposed to 13% of white students. So double the, not double, but significantly higher rates. And more specifically, looking at emotionally EBD in that area. Over the last several years, African American students are put into EBD programs. 4% of the student population is, compared to less than 1% of white students. And among American Indians, it's just as bad or higher. And so that disparity exists, and these complaints, they're not recent. They go back. There was a complaint filed in 1988 to try to address this disparity, and we just really haven't made much progress on it. And that's what's concerning to me. And why does this matter? Well, if you get referred, if you get labeled as EBD, you have a 40%, as I understand it, graduation rate in this state, which is low. And when you get to these level 4 programs, so the most serious programs, in Minneapolis, as an example, at the Harrison Education Center, we have a 6% graduation rate and a 4.5% proficiency in. They actually only can do it in math. They can't even do it in reading. Now, there's lots of reasons for that, obviously, but I do think one of the things we do when we label kids, and some kids need to have these services provided for them, but in many times, we are really condemning them to academic failure in many ways, especially when they get into some of these level 4 programs in some of our districts. And the research shows that poverty is a factor in this, and those socioeconomic factors, but that doesn't explain the whole disparity we have in the referrals, and cultural bias plays a significant role as well. And so that's really what this bill is getting to. I just want two other things, then I'll turn over to the testifier. In talking to parents and licensed social workers who work in this area, one of the other things that they have mentioned is that a lot of parents sign these documents, and for a variety of reasons, without really understanding these implications. And as we move forward, I think another thing that we should really think about is what kind of information and notice and explanation we give to parents before they actually sign documents, sending their students down a particular path. I think that's a serious issue. And I also think, quite frankly, looking at the incredibly broad definition we have of EBD in this state, which basically you can fit just about any student. I mean, as I was reading through it, and you have to have some academic and or educational impact, but the initial assessment, all three of my kids probably fit one of them. You can either be too quiet or too loud, or you can be too aggressive or not aggressive enough. It basically encapsulates just about every behavior probably every one of us who has kids has seen in their kids at one time or another. So I think that's worth looking at beyond the scope of this bill, but I hope that that's something to proceed. But I'd like to turn it over to the testifier.
Welcome, sir, to our committee. Please say your name and begin.
Madam Chair and committee members, my name is John Pauly, and I am a third-year law student at St. Thomas, where I'm also finishing my master's in public policy.
And will you spell your last name, please?
Sure. It is P-A-U-L-E-Y.
Thank you. I had it correct. Thank you. Please proceed.
During my second year, I worked in the St. Thomas Legal Services Clinic as part of the Community Justice Project. Here, I took over a research project that was previously started by another student. In short, we examined the negative academic consequences and damaging psychological effects caused by overdiagnosing students of color with emotional behavioral disorder. Emotional behavioral disorder, or EBD, refers to a disability in an educational setting due to poor social or academic adjustments that cannot be better explained through biological or developmental disabilities. For example, some of the behaviors associated include hyperactivity, panics, being socially withdrawn, exercising tantrums, acting defiantly, and arguing with authoritative figures. Now, I know we have a full list of bills today, so I'll be brief with our research. At the end of the day, this bill and the purpose behind our research is about one thing: closing the achievement gap here in Minnesota. Our research stems from a certain set of data. Mainly, students of color here in Minnesota were diagnosed with emotional behavioral disorder at more than 4 times the national average. This racial disparity was the highest among all 50 states. Now, when a certain student population is overdiagnosed, there are 3 issues that need to be addressed. First, why is there an overrepresentation? Differences in cultural norms often lead to misdiagnosing, which is where this bill's cultural competency aspect comes into play. For example, say we have 2 houses, each with its own social norm. It's not a matter of which one is right or wrong. Each household simply has its own different way of acting in group settings based on its own cultural norms and backgrounds. Second, what are the psychological effects of labeling a student with a learning disability that may not even be there in the first place? In their minds, these students are labeled as bad. There's a stigma attached that results in self-doubt and a lack of confidence. Therefore, a self-fulfilled prophecy arises, meaning a student begins acting out simply because they're expected to act out. And third, what are the fiscal impacts of an over-enrolled and overdiagnosed student population? A significant amount of resources goes into special education programs. These resources could be used much more efficiently if they were focused on the students that truly do have disabilities in the classroom. In closing, I'll say this. Every education committee here in the legislature shares common goals, one of which is to close the achievement gap. The achievement gap is a complex issue with no easy, no quick, nor single solution. Nevertheless, this bill and its emphasis on cultural competency is a step in the right direction if we're looking for classroom-based solutions that help close the achievement gap here in Minnesota. Thank you for allowing me the chance to speak, and I welcome questions as time permits.
Thank you, Mr. Pauly. Representative Thissen?
Yeah, I have one other testifier for just briefly, if the chair is okay with that?
Absolutely.
Okay. You want to,
Please come forward.
you want to say something?
Mr. Pauly, don't go away because I'm sure there are questions for you. Welcome to our committee. Please say your name for the record and begin.
Good morning, Madam Chair, members of the committee. My name is Nakima Levy-Pounds, and I was a law professor at the University of St. Thomas during John Pauley's tenure, and this was the research project that he was responsible for. And I just want to reiterate the importance of addressing the issue of cultural competency with regard to emotional behavior disorder. It's just one amongst many issues as far as the way that children of color in particular are being treated within the public school system. This issue came to our attention, number one, through a series of Star Tribune articles where they actually focused upon the racial disparity in overdiagnosing children of color with EBD, but they also looked at the fact that white children are also being overdiagnosed in the state of Minnesota, which is an issue from our perspective that has to do with competency on the part of those who are labeling children EBD, as well as the need for cultural competency. As Paul Thissen talked about, one of the issues that continues to arise has to do with children being labeled EBD and winding up in what's known as the school to prison pipeline, how they're more likely to be sent to special education programs, where they may be more likely to be around children who actually have more serious issues, and it has an impact on their behavior, it has an impact on their academic outcomes, and they may be more likely to wind up in the juvenile justice system. And once a child winds up in the juvenile justice system, there's a greater likelihood that he or she will wind up in the adult criminal justice system. So this has impacts far beyond education, and I would ask this committee to take a serious look at this bill as one step towards addressing the opportunity gap in education as John talked about in his research.
Thank you, Ms. Levi-Pounds. Are there questions for these two testifiers? Representative Bly.
Thank you, Chair. In a little bit of background, I was an EBD teacher for a number of years, and there's nothing wrong with your proposal. I think that it does hit upon some good things. However, I learned as an EBD teacher, I was in a level 5 program, and I talked with my supervisors and asked if I could be let go from the classroom for half a day to meet with teachers and talk with them about the students that they were having troubles with. And I'm just mentioning this as a possible addition to what you're thinking about. And that is that I found that teachers oftentimes were motivated for good things, wanting to help a student who seemed to need help. And the answer that they were thinking was, let's get them to a place where they can get some help. My efforts in meeting with the teachers individually was to try to help them figure out how to keep that child in their classroom, how to work with them so that they could continue to be part of it, how to manage behaviors in a different way and understand that really all behaviors are a means of communication. And you can either try to quelch that communication, or you can try to understand it and listen to it and perhaps even grow a relationship that could be developing. And I think that the aspect that you're talking about with cultural understanding is really important and shouldn't be diminished. But I also wonder if whether this was a person that had cultural background or a deeper understanding of the emotional disabilities or problems that students might face, going and counseling with a teacher and changing that notion that the answer is to get that student out of the classroom rather than staying in the classroom is probably really important. And so I guess my question is that something that you could think about? One last thing I want to say is that I think that the whole idea of this achievement gap, which is important for us to pay attention to, but exacerbates this problem. For some teachers who want to make sure they have high-performing students in their classroom, there's whether they're good-minded or not, there's a sense of wanting to move those students who need that extra help out of their classroom and somewhere else. And I think it's something we need to remind ourselves of, that that's a potential issue. So if you have any comments or about that, I'd appreciate it.
Ms. Levi-Pounds.
Thank you, Madam Chair. So I would agree that it's important to have someone who is culturally competent helping to coach teachers around this issue. When we looked into some of the criteria for being able to diagnose students with EBD, that there was no requirement that the teacher have a bachelor's degree, for example, in psychology or anything specifically related to EBD, a master's degree in EBD would be sufficient. And so you may have people who had a discipline such as English, but going and getting a master's degree and a certification in EBD able to actually diagnose people without enough training and history surrounding that particular issue. That leads to part of the problem as well. And so coaching, of course, is important to ensure that teachers know that there are other tools available for de-escalating behavioral problems within the classroom, and also making sure that they understand the consequences of pushing children out of the classroom who do not deserve to be pushed out of the classroom. Often they're sent to behavioral interventionists where they're not learning anything, or they're sent home, they're suspended for days at a time, and they come back and they're further behind. So I think as much as we can ensure that there are appropriate interventions in terms of how we address this issue, along with other ways that we address special education, will be critical in addressing this opportunity gap in education. I think parents would appreciate that as well, and being trained on how to address issues that may arise at home when their children are acting out.
Representative Bly.
Just one last comment. I was an English teacher that became an EBD teacher, so just so you know, and I understand what you're saying. One difference in the way that I looked at my job, though, was that I would not diagnose someone with EBD without the school psychologist backing me up or participating in that. And I think that's very important, that the EBD teacher is not skilled enough or not trained enough to do diagnosis and needs to have that extra help in order to do that. So I agree with you.
Thank you, Ms. Levy-Pounds, for your testimony. Representative Mariani.
Thank you. Thank you, Madam Chair. Excuse me. And welcome, Ms. Pounds, to the committee. And I appreciate Representative Bly's questions, but I'm a little disturbed by the information I think I heard about what's common practice. And so, being a layperson, I just want to be clear. So I understand Representative Bly would confer with a school psychologist, which I suspect are about as common as four-leaf clovers are in reality in our public schools. So what I want to know is, did I hear the testimony right that we have professionals who are teachers, good folks, who do not have any even undergrad training, content knowledge in the area of psychology, that are diagnosing children to be eligible for EBD, and then therefore placing them in EBD streams in our schools? Is that what's going on in reality?
Ms. Levy-Pounds.
Madam Chair, thank you. From our understanding, there does not need to be a background in psychology or anything having to do with medicine or mental health in order for someone to enter that field at the master's level and then go on to be certified. Our standards are different from what happens in other jurisdictions. It's much more rigorous in terms of the qualifications for someone to be at a level where they can diagnose children, alone or in consultation with another professional. And I appreciate the representative saying that he consulted with the psychologist, but the reality is that, number one, those resources are typically scarce within many of our public schools, and beyond that, there's still an issue regarding a lack of cultural competency amongst some of our psychologists as well. Again, we're talking primarily about children of color, often from a lower socioeconomic background, and many of the professionals that they interface with do not share their same racial and ethnic background. And there's no real checks and balances to ensure that children are being diagnosed appropriately and that they're receiving care that will actually lift them outside of the achievement gap. As a matter of fact, a lot of them are languishing behind, as you heard from earlier testimony in terms of reading, mathematics, et cetera, and are less likely to graduate. So again, part of it is our structure. and the criteria for who is actually able to diagnose. And we can miss that because someone has a master's degree and they're certified, but that doesn't mean that they actually have a long-term discipline in that area that should qualify them to make such a critical decision for vulnerable children.
And Madam Chair, just to follow up, and I need to follow up more on this, but one of the things I've been learning is that there are several school districts, because of this shortage, who contract with the Department of Education and have outside groups come in, and sometimes the people doing it are students or interns that, you know, are in a program to get to a mental health kind of, or psychiatric degree, but they are not yet there. So they're relying on interns and students to make these diagnoses instead, which is also troubling to me, kind of going to your point.
Senator Mariani?
Madam Chair, this is disturbing to hear, quite frankly. And I've been here a while, and I've chaired this committee, and I wasn't even aware of this. So bad on me, but it seems to me that, you know, we've kind of scratched the surface of something here that really needs to, that we need to dig into a lot more. And I would hope that we can do that in consultation with other people out in the field, but it's quite disturbing to me. Let me just ask one other question. Section 2 of the bill addresses the Pupil Fair Dismissal Act. And Ms. Pons, I think this gets at your testimony about, we have a system, quote unquote, that I would argue, based on what I heard here, doesn't even come close to maximizing, you know, sound professional standards relative to the labeling and placement of students in EBD and other special ed categories. But then there's this issue, and I think Representative Thissen, I think it was, that read the connection between that and graduation rates and other negative outcomes, I suspect, including high rates of removal from classroom. So this now goes to practices relative to the dismissal of students from schools. Can you say more about why it's important to have culturally competent individuals involved in that process of dismissal of students from school?
Absolutely. So, Madam Chair. In many of our public schools, particularly in urban areas, you have a very high percentage of white teachers and white administrators, and a high percentage of students of color. And so primarily you have people of color who are the behavioral interventionists within the school, or teaching assistants. And so when the decision makers have a cultural distance between children, it's very easy to overreact or misinterpret behavior, or even to more harshly punish students of color for the same behavior that their white counterparts are engaging in. I know that your organization has been involved in looking at these issues and seeing particularly that black boys are more likely to be suspended, let's say in Minneapolis Public School District, for nonviolent offenses, such as talking back to the teacher, doing things that are disruptive. That's the overwhelming majority of suspensions for a lot of African American students. And it's similar with African American girls as well. We've heard stories of girls in the classroom talking back to their teacher and being sent out. And sometimes they're actually suspended for that behavior. And it's very vague in terms of the reason and the rationale that's given for why they're being suspended. So I don't think that the dots are being connected between a teacher's desire to remove a student that he or she feels is disruptive from the classroom and how it is contributing to what we call the achievement gap. You know, as I referenced earlier, these students spending days at a time outside of school, being further behind in their classroom work, sometimes never even catching up, missing credits, and then ultimately a higher risk of not graduating. And so we need to make sure that we're monitoring this notion of implicit bias. We have a lot of police departments around the country that are now engaging in implicit bias training of officers, because it's in someone's subconscious whether they hold stereotypes against another group or bias against another group. It may not be intentional on the part of that person, but it's because of the conditioning that we often have as a society that causes us to look at the other as less than and different, and we can respond in a way that perhaps we did not intend. And so for many of these situations, as far as suspensions are concerned, I believe that implicit bias plays a role in terms of harsher punishments and longer suspensions for students of color, as well as an increased likelihood of sending those students to the school resource officer, who becomes the de facto disciplinarian in most school settings.
Thank you, Madam Chair. There's much more to dive into, but I know you've got other bills and other conversations. I appreciate us opening this vitally important issue. We're talking about 30% of the kids in our public schools, and that's only going to grow. And it seems to me that our ability to employ the full range of skills that's been developed out in the broader field, as you mentioned, Ms. Pounds, even our law enforcement communities. I know our St. Paul Police Department has immersed itself increasingly in becoming knowledgeable about implicit bias, developing culturally competent skills, and interacting with an incredibly diverse community here. It sounds like it's time for our public schools to catch up with that as well. Thank you, Madam Chair.
Thank you, Representative Mariani. In defense of teachers, remember, they're decision makers. They make thousands of decisions in a day, because every single thing you do in the classroom, is based on a decision you have to make. And I do believe that we have a process in place for special education. So if it has gone awry, then we need to check that. But there is a process. Students are just not diagnosed by a teacher and placed in special education. There is a process to follow. So I honor that process that they follow, and I really believe they do their best to try to do that. But maybe we need to, provide, as you've suggested, and Dr. Polly, with more training. And certainly that should occur at the teacher preparation level for our new candidates, and within staff development for the rest of our teachers. So thank you very much for being with us, and Dr. Polly as well. Representative Thissen.
Yeah, if there's no other questions, just in closing. But first of all, thank you for holding the hearing, and I agree with Representative Mariani. I mean, this is a kind of a little bit of a sledgehammer approach to a much more nuanced problem, and I hope that we can have further discussion to kind of get at the details of it, although I also want to make sure we do it in a way that kind of respects each individual school district, which is kind of why it was drafted this way, to develop the policies that work for their district. And I also want to say both my mom and my sister are EBD teachers, so I'm kind of coming at it from that perspective as well. And, and the last thing is, notwithstanding the Harrison School, I just do want to say in Minneapolis is actually making some improvements, and over the last 2 or 3 years have made progress. I mean, the results are not there yet, but my understanding is that some of the, within that building, there are changes being made, and I think it just shows the importance of good leadership at a site. And when you have good leadership, you can change, but if that goes away, that could slip back very much, which is why I also think we need to have good policies at the district level in place. So I really appreciate the time, and I think that there's more work that needs to be done to dive into this, but I appreciate you having the hearing, Madam Chair.
Thank you very much, Representative Thissen, and I know the department is here and they have been listening carefully, so I know Mr. Uni will take that back to Commissioner Casalius. With that, Representative Lee renews his motion that House File 341 be laid over for possible inclusion in an omnibus bill. Thank you very much to both of you testifiers and to you, Representative Thissen.